Did you realize that the way you rest tonight might determine if you wake up feeling recharged or not at all? It may sound intense, but bear with me. Each night, countless individuals settle into bed believing they're giving their minds a chance to recover. But what if, instead of healing, your brain is being deprived of essential nutrients, all because of the angle at which your head meets the pillow? Let me ask, have you ever gotten up with tingling in your arm, a strong headache, or a wave of dizziness with no clear reason? You might have blamed aging or a strange dream. But could your sleeping posture be subtly compressing key arteries, hindering circulation to your brain, and silently raising your chance of stroke? This isn't meant to alarm you, but after years of studying the human brain, I've seen numerous cases where the real danger wasn't from daytime habits, but from nighttime routines. In today's video, we'll uncover the most harmful ways to sleep habits many people have had for decades without realizing the potential harm. But it's not just about what to avoid. You'll also discover simple tweaks that could help protect your mind, heart, and long-term well-being. If you or a loved one is over 60, this could be the information that changes everything. Drop a white in the comments if you're a side sleeper, or blue if you rest on your back or stomach. And make sure to subscribe to Health Hub. Our mission is to help keep your mind alert and your body resilient. Now, let's go over the first sleep habit that may be doing more harm than you think. Let's begin with a position that seems innocent but may be silently harmful. Lying on one side for the entire night without shifting. It might feel comfortable, especially if it's a routine developed over years. But here's the catch. Staying on one side too long can compress the carotid artery on that side of the neck. This artery is one of the primary routes for blood traveling to the brain. When it's under pressure for extended hours, that side of the brain might receive less oxygen than it needs. I once treated a 67-year-old man who always slept on his side. Almost every morning, he'd wake up with numbness in one arm and partial facial tingling. He assumed it was due to poor circulation, but imaging revealed plaque buildup in his carotid artery, just enough that when he laid on it for hours, blood flow was noticeably reduced. He was at real risk for a stroke, all due to a seemingly harmless sleep habit. Even if you don't have any blockages, staying on one side for too long can still affect nerve function and blood circulation. You might feel your arm fall asleep faster or experience more soreness on one hip. Those could be warning signals. What should you do? Try changing sides throughout the night or place a cushion behind your back to prevent staying stuck in one position. If you sleep with a partner, ask them to gently prompt you if you've stayed in one posture too long. Now, let's discuss another overlooked factor, your pillow height. You might love that plush, elevated pillow that fits your head perfectly. But if it's too thick, it could bend your neck in a way that restricts blood flow to the brain. This especially affects the vertebral arteries, which pass through the spine and supply the brainstem. Imagine tilting your head downward for 7 to 8 hours, like looking at a phone screen all night. That's the effect of using an excessively high pillow. The outcome? You may wake up dizzy, lightheaded, or mentally foggy. I had a 72-year-old patient who adored her thick memory foam pillow. She kept waking with vertigo-like symptoms. We replaced her pillow with one that kept her head level with her spine. Almost immediately, the dizziness eased, and for those with narrowing arteries in the neck or spinal issues, which are common with aging, this extra tilt puts more stress on sensitive areas. Think of it like bending a hose. Water still flows, but just barely. What's the fix? Use a pillow that supports the natural curve of your neck without forcing your chin downward. Here's a quick test. Lie on your back and check if your nose aligns with your sternum. If your chin drops too far down, your pillow is likely too high. All right, now that we've covered pillow height, let's go over a sleeping posture that many don't realize can reduce oxygen to the brain. Picture yourself curled up tightly, knees close to your chest, head bent forward. It feels comforting, like a safe little cocoon. That's the fetal position. While it might bring a sense of security, it can limit oxygen and blood flow, especially to the brain. When you curl like that, you compress your chest cavity, giving your lungs less room to expand. That means less oxygen gets into your bloodstream and less reaches the brain. Add in a tall pillow pushing your neck further down, and the circulation issue worsens. One of my 69-year-old patients always slept curled up. She'd wake up with numb hands and dizzy spells. We tried everything, adjusting diet, improving hydration, but nothing helped until we modified her sleep posture. She started using a thinner pillow and placed a cushion between her knees to keep her body more aligned. Within days, the numbness was gone. Sleeping tightly curled can also pinch nerves, causing that tingling in your hands or feet. If you've ever awakened feeling like your arm isn't even part of your body, that might be the reason. Instead, try lying on your side with a slight bend in your knees, not in a tight curl. Use a pillow behind your back to support your spine and keep your head in line. It doesn't have to feel stiff, just open enough so your lungs and blood vessels can do their jobs. Next up, a common mistake even back sleepers make, one that can cause headaches and ruin sleep quality. Sleeping on your back is often praised as the healthiest position, and it often is. But there's a catch. If your neck lacks proper support, this great posture can turn harmful. If your pillow doesn't match your neck's curve, your head might tilt backward or shift sideways, applying pressure on small but critical blood vessels. At the base of your skull, these vessels control blood flow to brain regions responsible for sleep, balance, and coordination. If they're compressed, you may face headaches, dizziness, or poor sleep. One of my male patients in his early 70s had this exact problem. He used a flat pillow, letting his head droop backward all night. He woke up tired, with tension in the back of his head. Switching to a cervical support pillow that kept his head aligned brought major improvement. His headaches faded and sleep became more restorative. If you sleep on your back, check how your head rests. Look for a pillow that hugs the curve of your neck and keeps your head in line. This small change can have a major impact, especially for those with past circulation issues or minor strokes. Now, let's explore a posture that's especially risky, not just for the brain, but for the heart and lungs too. Sleeping on your stomach. It may feel like it eases pressure on your back, but it creates serious strain on your neck, heart, and lungs. Your head has to twist to the side for hours on end. This constant turning can compress the carotid artery, the main vessel delivering oxygen-rich blood to your brain. I once worked with a man in his mid-60s who always slept on his stomach to reduce snoring. Over time, he developed morning chest tightness and brain fog. After a detailed exam, we found that stomach sleeping was overworking both his neck and his breathing. His blood pressure was elevated, and oxygen levels in the brain were lower during the night. Reduced oxygen in your bloodstream means less oxygen gets to your brain. And if you already deal with high blood pressure or arterial stiffness, that drop in oxygen can be even more dangerous, dramatically increasing your stroke risk. If you absolutely have to sleep on your stomach, try placing a thin cushion beneath your hips and avoid using a pillow, or choose a very low one for your head. Even better, retrain yourself to rest on your back or side. It might take a bit of time, but your heart and brain will benefit in the long run. Next, let's talk about a habit that may seem harmless, even comforting, but could be turning your bed into a hidden threat to your brain. Sleeping with your head completely under the blanket. It might feel cozy on a cold night, but when you cover your face while you sleep, you're trapping the carbon dioxide you exhale and cutting off fresh air supply. This creates a mini greenhouse of stale air, precisely the kind of environment your brain doesn't want while it's trying to heal and reset. I once spoke with a 70-year-old man who liked to sleep fully covered during winter. It helped him fall asleep quickly, but every morning he'd wake up foggy and slow. We checked oxygen levels in his bedroom and under the blanket, and the CO2 concentration under the covers was clearly much higher. His brain was being forced to function with limited oxygen. Low oxygen or hypoxia can make your blood thicker and raise the chance of clot formation, especially during sleep when circulation naturally slows down. That increases the risk of nighttime strokes. High carbon dioxide levels can also mess with your sleep quality and lead to headaches or confusion in the morning. Stay warm and safe. Layer your blankets, but keep your nose and mouth exposed. If your room gets chilly, consider a heated mattress pad or a breathable wool blanket instead of burying your face. Remember, your brain needs oxygen more than it needs warmth. Now, let's examine another behavior that might seem harmless: falling asleep in your favorite recliner but could quietly reduce circulation, especially for older adults. It feels relaxing, even luxurious, dozing off in a recliner chair. Maybe you've nodded off during a movie or taken an afternoon nap in that favorite seat. But sleeping semi-upright every night can gradually increase your risk of dangerous blood clots, especially past age 60. Here's why. When your legs are positioned below your heart for hours, gravity slows down circulation in the lower body. Blood pools more easily, raising the risk of clotting in deeper veins, a condition known as deep vein thrombosis or DVT. And if one of those clots travels to your lungs or brain, it can become life-threatening. I had a 74-year-old patient who slept in his recliner every night due to back pain. He felt more at ease sitting up, but after several months, he developed swelling in one leg and shortness of breath. A scan revealed a clot in his calf that had reached his lungs. He had no idea his chair was the problem. Even if you feel fine, that sleeping posture reduces blood return to your brain and heart, leading to lower oxygen delivery and increased stroke risk over time. It's particularly dangerous if you stay still too long without moving your legs. If you need to nap in a recliner, keep it brief. Use a footrest to raise your legs and flex your ankles every 30 minutes. But for overnight rest, your bed is still the best place, flat, supportive, and built for healing. Now, let's talk about a side sleeping habit that may quietly increase the buildup of toxins in your brain. Not all side sleeping is equal. Sleeping on your left side may offer some benefits, but sticking to your right side every night might cause problems. That's because the body isn't perfectly symmetrical, and the position you sleep in affects how fluids and blood move, especially in the brain. When you rest on your right side for long periods, it can put pressure on the inferior vena cava, the large vein that returns blood to the heart. That pressure can slightly reduce overall blood flow, including what reaches your brain, but the bigger issue is what's happening inside your skull. Research shows that sleeping on the right may reduce how effectively the brain clears out waste. Through the lymphatic system, this system helps flush away toxins, including proteins linked to neurodegenerative conditions like Alzheimer's. A study from Stony Brook University found that animals sleeping on their right side had slower removal of harmful proteins from the brain. I had a 68-year-old patient who always rested on her right side. Over time, she noticed more brain fog and memory lapses. After discussing it with her neurologist, she began using a body pillow to transition to sleeping on her left. Within weeks, her mental clarity noticeably improved. If you're loyal to your right side, try alternating sides or use cushions to make left side sleeping more comfortable. Supporting your top leg and arm can make a huge difference. Now let's move on to another hidden risk: cold air and poor neck support that could quietly reduce oxygen flow to your brain while you sleep. Have you ever fallen asleep in a cold room without thinking twice? Cool environments can support good sleep, but if your neck isn't supported and your room is too cold, you may be setting yourself up for reduced circulation and higher stroke risk overnight. Here's the science. When it's cold, blood vessels constrict to conserve heat. But when that happens around your head and neck, it can limit how much oxygen-rich blood reaches your brain. If your neck is also unsupported, those blood vessels can get compressed or stretched, making things worse. I treated a 66-year-old woman who loved sleeping near an open window even during winter. She'd often wake up with a stiff neck and pounding headaches. After making some changes, adding neck support and warming the room slightly, her symptoms decreased significantly. The key here is balance. A cold room combined with poor posture creates a silent threat. Muscles tighten, circulation slows, and your brain misses the oxygen it needs. So what should you do? Keep your bedroom around 65°F, but consider wearing a light scarf or neck wrap if you get cold easily. Most importantly, use a pillow that supports the natural curve of your neck. Your neck should feel gently cradled, not pushed forward or strained. Sleep isn't just rest. It's when your brain performs its most critical functions: repair, recovery, and renewal. But here's what most people miss: the way you sleep either supports that process or quietly disrupts it. Head position, neck angle, even the side you sleep on, all of it matters more than you think. The best part: you're in control. With just a few simple changes, choosing the right pillow, switching positions, or breaking a few bad habits, you can protect your brain as you rest. So tonight, take a moment before drifting off. Ask yourself, is my neck supported? Am I breathing freely? Is my spine aligned? These small, quiet checks might be your best defense against memory loss, stroke, or waking up in a fog. If even one idea here helped you, drop a white in the comments to let us know, and don't forget to subscribe to Health Hub for more brain-smart sleep tips to help you stay strong, age well, and protect your most precious organ, your brain. Sleep well, friend. You've earned it.